Hello again, and thank you for joining us in this video today. Here we're talking about why stabilization is the critical first step to the recovery process. When it comes to a starting point, Peak's recovery is an ideal first step, the most important breakthrough step to the beginning of a journey towards sobriety. We are what you call a stabilization recovery center, and as I've mentioned before, if this is the visual timeline of a recovery journey, we would be here at the beginning. And technically speaking, we are a medically monitored, intensive inpatient detox and clinically managed, high-intensity residential program. To us, this simply means stabilization. And with any stabilization recovery model, there should be two main areas of focus. First, withdrawal stabilization. When a drug is abruptly stopped, withdrawal symptoms can be painful and even life-threatening, and withdrawal stabilization addresses the physical dependence on the drug of choice in a safe, medically supervised detox setting. To address symptoms associated with withdrawal requires 24/7 patient monitoring by licensed providers, mid-level providers, and a dedicated nursing team. We're proud to offer a very comfortable, campus-style residential detox environment. We have an in-house culinary team, comfortable rooms spread over 10 acres, and a patient-centered focus. However, and above all, what's most important at this stage of the recovery process, which can often be the hardest and most dangerous part of a recovery journey, is that our detox facility is fully staffed with medical professionals. We provide 24/7 nursing, a full-time psychiatrist, and a full-time medical doctor with over 15 years of emergency room experience, including 2 physician assistants serving a maximum of 6 patients in our detox setting at any given time. This creates the safest environment for you or your loved one to detox in. With this much medical support available, all patient needs can be swiftly addressed in a moment's notice, whether that's adjusting medications, addressing physiological issues that may arise out of the detox process, or simply providing assurances to the patient that everything is going to be okay. The second and equally important part of the stabilization model is craving stabilization. For the sake of this video, we refer to craving as the adapted physiological brain state that leads to the compulsive, drug-seeking behavior that drives addiction. This is where the foundation of understanding the underlying cause of addiction is built. As you may be familiar with, a craving is a powerful, abnormal desire for something you want, but don't exactly need. Over time, the perpetual use of substances causes individuals to form associative patterns, habits, and triggers that make cravings nearly impossible to ignore. Through the myriad of therapies offered throughout our 45-day curriculum, matched specifically with what our clinical specialists identify as the ideal starting point to you or your loved one's recovery journey, we can begin to disrupt the exasperating craving states while also embracing the scientific notion of neuroplasticity in the formation of new and healthier habits. Within our curriculum, we've created a clinical focus to walk through grief and loss, trauma, life experiences, community immersion, the challenges ahead, and so much more. Finally, we believe that addiction is a mental health disorder equal to other debilitating disorders such as major depression, anxiety, and bipolar, to name a few. Whether a craving state is triggered by co-occurring or dually diagnosed issues, or whether or not you have a straightforward mental health primary concern, we strive to create inclusive language within our treatment setting to nurture and alleviate you or your loved one's suffering, regardless of the cause. We are a true dual diagnosis facility. Above all, any addiction treatment center should be staffed accordingly to meet the needs of the acuity brought about by craving states, as patients meeting the criteria for these levels of care are still generally acute and act impulsively. Peak's Recovery Centers has nearly 80 staff members dedicated to a maximum of 30 patients at any given time. Having a team of dedicated clinical, medical, residential, case management, and administrative staff to support individuals through their ambivalence regarding their addiction is no easy task. Teams have to be able to respond to patient acuity in residential programming 24 hours a day, not just 8 a.m. to 5 p.m. In the following video, we will highlight why this stabilization period is so important within the recovery journey.